Okay, so we talked about causes of pain and pain pathways, and now we're going to talk about methods of managing pain. So some of these are medical and surgical, so clearly we're not doing them in physical therapy, and there are other ways of managing pain in physical therapy, but also it's important to note that in physical therapy, we are not working alone, we're working as part of the healthcare team. So we should know about these other methods of managing pain. So really for mild pain, pain can be managed in a number of ways in addition to removing the cause of pain as soon as possible. The most common medical method is the use of analgesic medications. So these drugs can be administered in a lot of different ways. So orally, parenterally, by injection, transdermal patch. Usually analgesic medications are classified by their ability to relieve pain, mild, moderate, or severe pain. So there's another one of my favorite little green charts in the book that talk about different drugs for mild pain, moderate pain, or severe pain, and their effects, their action and their effects. So I'm not going to expect you to know all these drugs, but just to know of them. So some of for mild pain, most of them act in the periphery, and we will talk more about this in clinical neurology class. Some of them, and these are like our aspirin and our NSAIDs, anti-inflammatory in the periphery. The ones for moderate pain usually act on the central nervous system, and they affect the perception of pain. For severe pain, a lot of these are ones that are injectable, which act on the central nervous system. They can cause euphoria and sedation. Those are the ones where there's an issue with tolerance and addiction. High doses of the severe pain medications depress respiration. They can cause nausea and constipation. Some of the ones for moderate pain are the narcotic combined with aspirin or acetaminophen. And high doses, again, may depress respiration because the narcotic pain medication is in there. So other drugs are often prescribed for managing particularly chronic pain. Sedatives and anti-anxiety drugs like Xanax and things like that can be used as adjuncts to analgesic therapy to promote rest and relaxation, to take the anxiety component out of the pain reaction. Using a combination of drugs may reduce the dosage requirements for the analgesic. For chronic and increasing pain, a lot of times the anti-anxiety drugs are used because a lot of times in cancer, you do get increasing pain as the cancer progresses. They will use it in a stepwise fashion to reduce pain. So a lot of times in a cancer care setting or an inpatient setting, there are pain management teams that help develop pain solutions for each individual patient, because we know that pain is individual. The thing with narcotics is you do develop a tolerance over time. So people end up having increased dosage requirements, and they may require being shifted over to a new drug because the old drug isn't working anymore. So when you get into severe pain or intractable pain, which is pain that cannot be controlled with medication, we often get into things where patient-controlled analgesia. If you've ever seen someone in the hospital, they have their little pain button. So they have an IV, and that controls their pain. It lessens the overall consumption of narcotics because they're getting little micro doses of it over time, and also gives them a feeling of control because they're the ones controlling it. There are limits on it, but they're the ones controlling it. If the pain cannot be controlled with medication, it's considered intractable, and they often use surgical intervention in that case. So a rhizotomy or cordotomy or injections. So a rhizotomy is where they take out a nerve root. A rhizome is a nerve root. where they sever part of the spinal tracts in the spinal cord, or injections directly into the intrathecal space or into the nerve itself. Those are obviously not ones that we do in physical therapy. Anesthesia can be used to decrease pain. Local anesthesia, injected or applied to the skin or on mucous membranes. A lot of times that's used in dentistry. They put the local anesthesia on before they then give you the injection. Spinal or regional anesthesia can block pain in the legs or abdomen. Those are often used for surgeries like total knee replacements, total hip replacements. General anesthesia causes total loss of consciousness by gas or injection. And neuroleptic anesthesia, the patient can respond to commands, but they're relatively unaware of the procedure and there's no discomfort. So the idea is you want to use the least effective dosage, and it's up to the doctor and the anesthesiologist to figure out what that is. These days, they really try to limit the use of general anesthesia unless it's absolutely needed, and they tend to go more with the spinal or regional or neuroleptic anesthesia, just to make sure that they're not over medicating people. So another nice green table in the book describing anesthetics. And it tells you, and it gives you an example, what the effects are and what the purpose is. So hopefully that's clear. Obviously, we're not doing these in physical therapy, so I don't expect you to know the details on these, but I want you to know that it exists because we get patients coming in that have had these things.